Hello everyone, welcome back to Work Medicos. Today's topic is about wound healing and repair. So let's start the video. Firstly, what is healing? So healing is the body's response to injury in an attempt to restore normal structure and function. What does it mean? If an cut or abrasion occurs in the skin, the body will try to restore its normal structure of the body part so as to perform the physiological function normally. So, healing is the body's response to injury in an attempt to restore its normal structure and function. Whatever the injured part is, the body will try to restore its function. Healing involves two processes. First is regeneration and repair. So, what is regeneration? When healing takes place by proliferation of parenchymal cells and usually result in complete restoration of original tissues. So what does regeneration means? When regeneration means when healing is taking place by parenchymal cells. The growth of parenchymal cells will lead to complete restoration of original tissue, unlike in repair where healing takes place by proliferation of connective tissue. When growth takes place by connective tissue, it results in fibrosis and scarring, where you have seen in some burnt patients where the skin is burnt. So the healing, when the healing completely takes place, it results in the formation of a scar. So that type of healing is called repair and is done by growth of connective tissue, whereas in regeneration the growth will be done by parenchymal cells. Now we will see mechanism of wound healing. Now, healing takes place by two ways. First is healing by primary union and healing by secondary union. So, first is healing by primary union. This is defined as healing of wound which has following characteristics. Firstly, the wound should be clean and uninfected, surgically incised, without much loss of cells and tissues, and edges of the wound approximated by surgical suture. So, the example of this will be the surgical suture, means the wound which is operated by a surgeon. So firstly the wound will be clean and uninfected, surgically incised. Imagine a wound which is approximated with surgical suture. So first it will definitely be clean and uninfected so as to prevent growth of microbes or any organism, surgically incised without loss of cells and tissues. It is carefully handled by the physician so occur without much loss of cells and tissues. Edges of wound approximated by surgical sutures. Okay. Now steps of healing. This we have studied healing by primary union which has following characteristics. Now we will study how healing takes place. Okay. First is initial hemorrhage. What do we mean by this? In the first step, immediately after injury, the space between approximated surface of incised wound is filled with blood which then clot and seal the wound against dehydration and infection. So whenever a cut will occur in the skin, immediately the fibrinogen and all the platelets will arrive at the destination of the injury, where the injured part will be filled with blood and blood clot will occur which will seal the wound against dehydration and infection. So this is the first step of healing by primary union. Second step is acute inflammatory response. Appearance of polymorphs from the margin of incision. Polymorphs are further replaced by macrophages. Now the first step we have seen that the wound is filled with blood. Now the second step is acute inflammatory response, in which the WBCs or the white blood cells will arrive, or polymorphs which will arrive at the site of the injury, and it will try to eliminate any microorganism which is present. Further, the polymorphs are replaced by macrophages. If you have studied, this is similar to the acute inflammation where the steps of acute inflammation was vasoconstriction, vasodilatation, slowing or stresses of blood, and then for occurrence of the leukocyte. This is similar to that one. Okay, so first we have seen initial hemorrhage and second one was acute inflammatory response. Third is the epithelial changes. Epithelial cells from both the cut margins starts proliferating and migrating towards the incisional space in the form of epithelial spurs. So now what will happen? Imagine this is your incision. Now the epithelial cells will migrate towards the center, will form epithelial spurs. What is the meaning of spurs is extension. A well approximated wound is covered by a layer of epithelium. So epithelial cells will try to cover the wound and will migrate from the both edges of the wound to the center. So epithelial cells from both the cut margins starts proliferating and migrating towards the incisional space in the form of epithelial spurs. Next step is organization. Fibroblasts also invade the wound area. New collagen starts forming which dominate till healing is complete. After epithelial cells, fibroblasts will also invade the cells. New collagen will be formed so that healing can be performed. So we saw 4 steps till now. First was the blood clot or initial hemorrhage. Second one was acute inflammatory response. Third one was epithelial changes in which epithelial cells from both the margins will migrate towards the center. And last one was organization in which fibroblast will also invade the wounded area and new collagen will start forming, so then only the healing will be done. Okay, and last step is suture tracks. What do we mean by suture track? If you have seen a surgically incised wound, in that process healing will also takes place because the suture is an external component. So the suture track is a separate wound and follow the same phenomena as in healing of the primary wound. So the suture track will also follow these 4 steps which we have mentioned earlier. When sutures are removed around 7 days, much of the epithelialized suture track is avulsed and the remaining epithelial tissue in the tract is absorbed. So much of the epithelialized cell is pulled away and the remaining tissue is absorbed in the skin only. Thus, the scar formed in a suture wound is neat due to close apposition of the margins of the wound. So, in healing by primary union, the edges of the wound is neat and there is no formation of scar because there is close apposition of the margins of the wound. So this is a picture of healing by primary union in which we saw firstly there is initial hemorrhage occurring. The wound is filled with blood which is followed by acute inflammatory response. We can see the appearance of polymorphs or polymorphonuclear leukocytes. Now the polymorphonuclear leukocytes will be replaced by macrophages. So we can see here the presence of macrophages. These are the plasma cells. Epithelial cells also will be occurring in the form of epithelial spurs, and lastly fibroblast will invade the area and formation of collagen will occur. Okay, and in healing by primary union there is no formation of scar. Next we will see healing by secondary union. So it is defined as healing of a wound which has the following characteristic: open with large tissue defect, at times infected, having extensive loss of cells and tissues. The wound is not approximated by surgical sutures but is left open. So healing by secondary union in this the wound will have opposite characteristics of what was in primary union. So in secondary union the wound is large, the wound is open and large with tissue defect, at times infected. In primary union the wound was clean and uninfected. Here the injury is having extensive loss of cells and tissues. There in primary union there was no extensive loss of cells and tissues, and the wound is not approximated by surgical sutures and is left open. And in primary union the wound was approximated surgically. The basic events in primary and secondary union are same, but just in the healing by primary union there was involvement of surgical sutures. In secondary union there is no such thing. So the large tissue defect has to be bridged. This will differ in some steps which we'll see further. Now healing by secondary union is slow and result in large, at times ugly scar. Okay. Steps in secondary union. First is initial hemorrhage. The first three steps is same as healing by primary union. So I will not explain it again. The fourth step is granulation tissue formation. So main bulk of secondary union is by granulation, because in secondary union there is no sutures involved. So mainly the work is done by the formation of granulation tissue, which will close up the wound and heal the wound. So granulation tissue is formed by proliferation of fibroblast. New granulation tissue is deep, red, granular and very fragile. Fifth step is wound contraction. Contraction of wound is important feature of secondary healing, not seen in primary healing. Due to action of myofibroblasts, the wound contracts to 1/3 to 1/4 of its original size. So after the formation of granulation tissue which will heal the whole injury, now the wound contraction will occur. This is a main characteristic feature of healing by secondary union, which is not seen in primary healing, and the wound will contract to 1/3 to 1/4 of its original size due to the action of myofibroblast. Here granulation tissue was formed by proliferation of fibroblast, and wound contraction will form by due to the action of myofibroblast. And the last step is presence of infection. Bacterial contamination of open wound delays the process of healing and due to release of bacterial toxins. If there is a presence of any bacteria or microorganism, they will release harmful toxin which will delay the process of infection. So this is the picture of healing by secondary union, in which firstly the first three steps is common in both primary and secondary union, which is initial hemorrhage, appearance of polymorphonuclear leukocytes or WBCs, and third is the epithelial cell formation. Okay, the first three steps are common in both. Now the fourth step in healing by secondary union is granulation tissue formation, which is performed by the action of fibroblast. Here you can see fibroblast proliferation is occurring, which causes the formation of granulation tissue, and wound contraction is the characteristic features of healing by secondary union. Okay, so wound contraction will also occur in healing by secondary union, which will lead to the formation of scar tissue. Okay, scar will occur in healing by secondary union. So here you can see a scar formation. So here we have completed the complete topic of wound healing. If you understood this video, please like, share and subscribe to my channel. Thank you.